Yeah.
Good morning, everybody.
Wow, yeah.
We're continuing a conversation.
Sorry, we started early without you.
When it comes to healthcare, we just got done talking about a wonderful organization that helps with dentistry in our community. So let's talk a little bit more about healthcare and how we need to be planning for it now in the long term. Very excited to have Loren Merkle joining us, of course, with Merkle Retirement Planning. Thank you so much for being here, sir.
Thank you for having me.
Kind of a hot button topic is things in our healthcare world are ever changing here on a local level and across the country.
Yeah, it really is a hot topic because this healthcare costs, what we were talking about right before we went on air here is healthcare costs are so much. Age 65 plus, they estimate $280,000 that you will need to spend just on healthcare.
Just on, not living. Healthcare. This is just on healthcare.
Just on healthcare to get you through the retirement time frame.
Oh my goodness.
And the healthcare landscape has changed dramatically over the last 10 years. I mean, COBRA used to be a dirty word. We wouldn't want to talk about COBRA because it was your most expensive form of healthcare. And now COBRA is a lifesaver for many pre-retirees.
Really?
And that's why there's so many 63 and a half birthdays being celebrated. I mean, it is the party of a lifetime for a lot of people at 63 and a half. When's the last time you celebrated a half birthday?
Yeah,
every year. What are you talking about?
It's happening all the time.
Okay, explain that a little bit more.
Because from 63 and a half, at 65, you're eligible for Medicare.
Right.
And Medicare is a much more reasonable cost to get you through retirement. So at 63 and a half, you're eligible for COBRA.
Now explain what that is for the people that might not know.
If you have a group plan through your employer,
right.
You separate service from the employer. Now you have 18 months of coverage.
Okay.
It costs you a little bit more than what it costs you through the employer while you were working, but it is less than the open market.
Right.
And the open market today, if you're a married couple, $2,000, $2,500 a month is what it costs you. COBRA might cost you $700, $800 a month. So that would carry you to Medicare age of 65. And then at 65, you're eligible for Medicare, and then the big expenses for most people do diminish.
Okay. So how do we approach this conversation? Because you always say it's never too early or too late to start talking about creating your plan for your retirement. How do you look at that chunk of saying we really need to invest to make sure you're covered when it comes to healthcare?
When it comes to healthcare and long-term care planning, it's all about the strategy. It's about the strategy. It's not necessarily so much about how do you invest this bucket of your money. It's more about evaluating the options that you have. So let's go back to the healthcare piece. Okay. When you're 5 years out from retirement, you want to identify what your healthcare options are going to be. Today, you have the Affordable Care Act for some people if they qualify. You also have Medicare if you're 65 plus. You have COBRA if you separate service from the employer for up to 18 months. So you have all of these different options. Evaluate the quality of the coverage that those options will provide you, and then evaluate how much each one of those options are going to cost you. And through that analysis, it does become much more clear on which option is going to be right for you. But we live in this world of so much information. I mean, if you Google retirement planning, 312 million hits is what you come up with. So, and one of the challenges with retirement planning is it's very much self-led, right? It's very much self-led, meaning that you are the one that's going to take you to and through that retirement transition, and it is hard unless you hire somebody.
Yeah, it's hard
and
to
you don't know you don't know all the things that are available, like a professional like your company does.
The reason there's so much content out there online is because there's 10,000 people retiring every single day, and they need this information. They are seeking this information. Now, you try to wade through 312 million pieces of information just through Google.
You're not going to do it.
There's no way.
No.
When we're looking through at healthcare, is there any element or piece to it that we need to look at for like a just in case? Maybe we get a debilitating, diagnosis when we get a little bit older and need to be put into special care. Is that looked at all, or does that adjust as you're getting older?
That changes too, because in our working years, what we call that is disability insurance. What we call that is if you have a what if and you can no longer perform the functions of your duty, you have disability insurance, which is going to kick in and pay you because you can't work anymore. In retirement, now we're talking about long-term care. Now we're talking about maybe needing a facility to help us with our daily living activities, and that is a lot. With the families that we work with right now on a monthly basis, they are paying anywhere between $3,500 to $10,000 a month for care, to help them dress, to help them transition
Right.
within the
That's
house.
amazing.
It's a lot of money, and then just picture yourself now at 75 years old, and you've been in retirement now for 10 to 15 years, you've used some of the resources, and now you need an extra $10,000 a month just to maintain the daily living activities.
Right.
It upsets many people's retirement, and one of the biggest fears for retirees is if one of a married couple needs that type of care, then what is the rest of that surviving spouse's retirement going to look like?
Right, if you burned it all up.
If you burned it all up.
Right.
Because Medicaid is there, the state program is there to help you pay if you can't pay, but you have to have a spend down, which means most of your assets you have to go through before Medicaid kicks in.
Wow.
And then that surviving spouse is left with virtually nothing.
Absolutely. So these are conversations we can have with a professional to make sure we're getting everything lined up just right.
Well, and this is what creeps in, this is what allows that anxiety to creep in, because this is all the unknowns. And yes,
Right.
these are conversations.
Absolutely.
There's
that you need to be
anxiety
having
creeping
for
in
it.
right now.
Yeah.
You know, for people our age.
And really what helps with that is having that plan. Well, you know, we're always talking about the plan, and sometimes I feel like it desensitizes the need for the plan, but it should just create more of an awareness of how important this plan is, because nobody wants to go through this time that they've dreamed about all their life,
Right.
and then have all this anxiety, all this unknown and uncertainty. And that's that plan that takes the uncertainty out of it. So in the event a long-term care situation happens, that's an emotional enough event alone. You see a loved one go through that type of health condition and turmoil, that's emotionally challenging. Now you add the financial challenges to that.
Right.
And that's one of the things that the planning can help alleviate.
Yeah, retirement should be something you look forward to, not something you dread.
That's right.
Yeah.
That's exactly it. And it's the plan that helps alleviate that financial anxiety. There's not a lot you can do from the health side of it, right? The plan's not going to help you not need long-term care.
Right.
But if you do, this is the next step of action, right? So there's no questioning, and you just go with the next step of action, you address it, and you make the best out of it, but financially you're fine.
All right, Loren, instead of weeding
Wow.
through over 300 million options online, let's go to a professional. How can we get that conversation started?
You can go to merkleretirementplanning.com, and that's, Jackie, I think that's the hardest part, is how do you get started?
Right.
How do you get started? So we try to make this as simple and easy as possible. Probably the easiest way to get started with your planning is to attend our Passport to Retirement class.
Okay, and you do address that.
Yes, we talk about long-term care, we talk about healthcare. In fact, we dedicate a whole segment to just those topics. And moreover, we talk about retirement strategy, of how to alleviate the anxiety and make your retirement transition as easy as possible.
Now, just a little side note here before we wrap things up here, but when you are planning for this type of care and this type of coverage and want to get this money that you need, is this a separate bucket of money in your retirement plan, or is this all inclusive in one big bucket of money?
It depends on how you cover that risk. A lot of people today are choosing to self-insure it because buying long-term care insurance is really expensive.
Right.
You don't want to self-insure health care, right? You need some kind of health care coverage,
Right.
but long-term care is a different conversation. So if you're going to self-insure it, then yeah, a bucket approach, saying here's my long-term care money, here's how I'm going to invest it to accomplish it.
All right.
But then if you want to offset a piece of that risk, then you don't need as big of a pot over here. So it just depends. That there's no right or wrong. It's just what is right for you.
Yeah,
Right.
and that's why it's ready so
Call
right
one.
to start that conversation. MerkleRetirementPlanning.com. Find out when those workshops are happening so you can be a part of that absolutely free, and then further that conversation. Loren, thank you so much for joining us
Thank
today.
you guys
Thanks for
very
being
much.
here.
Thank you.